Hello, my name is Nicole Mason. I'm a psychiatric PA. I've been in clinical practice since 2005. I have a Doctor of Medical Sciences from the University of Lynchburg. I'm currently NCCPA certified in general medicine and psychiatry. So what I'm going to talk about a little bit today is Spravato, including its history, its uses, and current research on Spravato. So for those of you who've heard about it in the news, Spravato is a derivative of ketamine. Ketamine is a analgesic medicine that has been around since the late 50s. It's been in clinical practice as a sleep medicine since about 1970. It has had a interesting history in that there has been some abuse and misuse with ketamine. So basically, if you use it in higher than recommended therapeutic doses, you can get a high with ketamine. And so we've known about that for a number of years. Unfortunately, some of the side effects with using Spravato at higher than recommended doses can lead to complications like schizophrenia, like psychosis. So that means schizophrenia, you have some sort of hallucination about your actual reality versus what's going on around you, whether it's auditory, hearing, tasting, seeing, or smelling. So any of those can be considered a hallucination if it's not something that meets with what others around you are experiencing as well. And you can get that with higher than recommended doses of ketamine. You can also get addicted to ketamine if you're using it at higher than recommended doses. Thankfully, though, using it as you're supposed to has really relatively few concerns for addiction or schizophrenia-like symptoms. It's just in those higher doses that happens. In the past, there has been studies done on rats. In those studies, they found that ketamine and its derivatives were useful in helping with both anxiety and depression. And probably for the last decade, ketamine has been used off-label. So off-label means that the FDA hasn't specifically approved it for its given indication. So in about the last 10 years, ketamine has been used off-label for the treatment of depression, as an analgesic for pain, anxiety, PTSD, because there have been either anecdotal studies or studies in rats that have shown some improvement in these measures on these problems. Recently, Johnson & Johnson went through trials for a derivative of ketamine called Spravato or esketamine. It is a nasal inhalation formulation, so you inhale in each nostril 5 minutes apart. For a total usually of 3 doses after the first dose. And they went through the FDA trials and found that it was a very helpful drug for the treatment of treatment-resistant major depression and suicidal ideation. So what I get a lot in my practice is, well, what is treatment-resistant major depression? So according to the FDA, treatment-resistant major depression is when someone has tried a normal typical antidepressant, such as an SSRI or an SNRI, for a minimum of 6 weeks and hasn't had improvement. And they've done this for at least 2 different drugs in those typical normal categories. That is considered treatment resistant. You've tried the normal medicine that typically will help treat depression and haven't had a improvement with it. And then suicidal ideations means that you're having thoughts about wanting to be dead or harm yourself in some way without necessarily, or maybe, but not necessarily having an intent or an action plan with that. And so what Johnson & Johnson did is it took that subset of patients with suicidal ideations and treatment-resistant depression and put them on Spravato. And this is pretty remarkable in that they found that some patients experienced significant relief with just their first dose of medicine. And that's huge. This is for patients that haven't had any improvement on typical medicines to be getting improvements with just the first dose. At the end of 4 weeks, the trial showed that patients on Spravato showed response 69% of the time. So again, you've got patients that are thinking about wanting to be dead, as well as patients that have not responded to your typical medications, and they're having a 70% response rate. What they also showed at that 4-week mark is that you're going to have about a 50% remission rate in this treatment group. So these are a hard to treat group, and 50% of them will be in remission with their depression at 4 weeks with the Spravato. And this is huge. This is remarkable. With that FDA trial, though, they did keep the patients on a typical antidepressant medicine like an SSRI or an SNRI treatment. So when the FDA approved the drug, they said, fine, you can go and have this indication for Spravato, but you have to stay on a typical antidepressant in addition to the Spravato. And so that's a pretty important takeaway from the medicine, that you have to be on a typical medicine while you're on the Spravato. How does one take Spravato? So typically during the first month, the treatment is to come into the office for 2 hours and to inhale the medicine and to be monitored clinically in the office. At varying points in that treatment time, you will have your blood pressure taken, other vitals taken to make sure that you're not having any problems. At the end of the 1 month, you'll move to weekly appointment times. At the end of 2 months, so 3 months on, then you'll move to every 2-week treatment times. Something that's important to note about the medicine is that you cannot drive home currently with FDA guidelines on the medicine. And that's because, again, ketamine, this is a derivative of ketamine, is used as an analgesic. And so there is a level of sedation with esketamine or Spravato. And so the FDA has mandated that you must have a good night's rest before you can drive again. And so what this means is that you have to have a family member or a friend or an Uber or a taxi come and pick you up from your in-office treatment to go home. So what are some of the common side effects with Spravato? So the 3 big side effects are nausea and vomiting, as well as dizziness, vertigo, so like a room spinning kind of sensation, and then dissociation. So dissociation is kind of like an out of body or floating experience that you might have as well. So those are the 3 big common side effects. There are other less common but also occur, and that's like the sense or urgency to pee. And so typically if you're on Spravato, you're going to want to come to the office and go to the bathroom and try to urinate before you take the medicine, so that you're not dizzy trying to get up, walk around, and needing to pee. Contraindications, so reasons why you wouldn't want to take Spravato for any reason. If you have an aneurysm, you wouldn't want to take Spravato. If you have an abnormal congenital problem with your blood vessels called an arteriovenous malformation, you wouldn't want to take Spravato. If you've had a recent brain bleed, you wouldn't want to take Spravato. And if you've ever taken ketamine and had a bad reaction to it, you also wouldn't want to take Spravato. Now, Spravato is not the only way to treat treatment-resistant depression. There are some other modalities that you can use. So ECT is probably the most common other modality. And ECT is electroconvulsive therapy treatments. It typically is a treatment that requires sedation, as well as usually a clinical treatment room setting, and requires several treatments in order to be effective. TMS is also transmagnetic stimulation is also another possible component that you could use to treat treatment-resistant depression. Typically, you will come into the office every day for 6 to 8 weeks with that treatment, and you'll have treatments anywhere from 20 minutes to an hour with adjustments needed as well. That's another way. And then vagus nerve stimulation, which is kind of a surgical procedure that stimulates the vagus nerve. That would be another treatment modality for treatment-resistant depression. So Spravato is by no means not the only modality out there that can treat that treatment-resistant depression. If you do decide, though, that Spravato is right for you, then from there you would move on to the prior authorization process. There are FDA guidelines, so 2 drugs for a minimum of 6 weeks without improvement of symptoms. However, each insurance company has their own particular approval process and requirements in order to meet their criteria for the drug. For example, some insurances require that you try 3 drugs for 8 weeks, in addition to a MADRS score, whereas other insurances are more lenient and they say 2 drugs from different classes for 4 weeks and a PHQ-9 score. So unfortunately, there is no streamlined process with the approval for the different insurances, but that's the next point in it. So after that, assuming that that process goes well and we're able to get all of that accomplished, then the drug would be sent to the office. You would be called. Typically, because this is a controlled substance, you will have a urine drug screen at some point before you start the medicine and then randomly throughout treatment. In terms of sedation, esketamine or Spravato is a sedative medicine, so you can't take other sedative medicines within 8 hours of taking the Spravato. And so that's anything from alcohol to marijuana to benzodiazepines. So you wouldn't want to take sedative medicines to increase the chances of decreasing your respiratory effort or not breathing. And so assuming all of that goes well, you start the medicine and then hopefully start to get improvement within that first 24-hour period. And if not within that first 24-hour period, then within that next 4-week period. So that's my discussion on Spravato. If you have any questions or comments, please leave them below. If you liked this discussion on Spravato, hit the like button for me. Thanks so much. Bye.